When I was younger, my father had passed away quite early of heart disease, and I had a few relatives in my family that had been diagnosed with cancer. So just really trying to help them out and prevent disease, and it just became a passion of mine. So if you're discussing like a well visit, definitely trying to make sure that I'm going through all of their health maintenance, whatever they're due for. If they're a child, making sure they're at least getting education about the vaccines, providing the vaccines, making sure they're growing okay, and discussing different concerns that parents may have. As far as my geriatric patients, I mean, definitely making sure we're talking about their medications, because I find a lot of times they're on tons of medications and they definitely don't want to be on so many meds, and sometimes they don't understand their medication. So just really reviewing that with them. And just making sure that we're going through different things that could plague them, like changes in their mood. I've made it a point to definitely address depression and anxiety. In fact, as part of our wellness exams, we are supposed to look into that and just make sure we're touching base with that. And then in particular, if I'm noticing like somebody is struggling with any sort of mood disorder, just talking about it and making sure that it's getting addressed. That's so rewarding, actually, and that's actually a reason I chose family medicine, is to have that continuity of care. I love seeing, you know, one patient and maybe next week or the week after seeing their spouse or their children. And I've definitely seen a lot of my kids grow, and it's just rewarding to see them change and go off to college or finish high school or go on to their next milestone in their life. So that definitely gives me, you know, a lot of joy, and I love to follow my patients for that continuity. I've recently grown to really love helping patients, you know, that are battling with weight, getting them to adopt healthy lifestyles and potentially using medications to help with weight loss, and just kind of watching them through that journey of really changing their body and getting their body the way that they, you know, want it to be or hope it to be.